My name is Eren Oyungu. I have a training as a medical doctor and further training as a pediatrician, and then a fellowship in pediatric neurology, as well as training in public health and medical physiology. So I attend to children within our teaching hospital. I attend to children who have neurological problems. We also in our neurology clinic see children with various disabilities, as well as teaching students and hoping that what we teach them will help foster the care of children with both physical and mental disabilities. Maybe first we'll talk about children with disabilities. Here we mainly referring to children who in one way or another may have inability to meet their daily requirements. These may include activities of daily living, as well as physical activities like play, which is very important for development of children. I would like to mention that perhaps when you look at disabilities, most of the children will have disabilities due to cerebral palsy, which is due to a problem with development of the brain either before, during, or after birth. So it's estimated that about 3 in 100 children in this country will have cerebral palsy. But looking at disability as a whole, it's perhaps more than 20 in 100 children will have disabilities. The care is a challenge here, especially if you look at the fact that early intervention will determine the potential of these children to meet their future capabilities. What we have mainly in terms of challenges is early diagnosis, because most of the people are not aware of the disabilities, and those ones who are aware may ascribe the disease to some other, maybe evil spirit or maybe some cultural beliefs, and they tend to hide the children or not bring them up for treatment. But even among those who bring them up to the hospital for treatment, we have challenges in terms of the capability of the medical personnel to care for children with disabilities. Some of them have not had training in this. We also have problems with the ability of facilities in the few medical centers that we have, so that children with disabilities may easily be turned away or asked to go home without necessarily being given opportunity to develop to their maximum potential. These challenges are not just limited to rural areas, they are also there in towns. For instance, in a small town, the only place that may be able to offer some service to these children is the teaching hospital. But the nearby county hospitals, the nearby health centers, and even private hospitals have got little in terms of facilities to diagnose and care for children with disabilities. You'll also find that some come from very far, and when you want to send them, for instance, for occupational therapy, where they have to go 3-4 times per day, it's very difficult for them because of transport to say they will come all the way to Eldoret from time to time. Now, based on this, we started thinking what would be the best way for us to intervene. We are now planning to improve the care of children with disabilities in the Moi Teaching and Referral Hospital. What we plan is that with the help of people from elsewhere, and especially the ones being coordinated by Dr. Megan, that we'll be able to set up a center in Moi Teaching and Referral Hospital that will offer treatment, and this treatment will include diagnosis of all disabilities. It will include interventions, especially occupational therapy, and where medication is necessary, we hope that this center will offer medication to these children. Number 2, we hope that this center will also be a center of excellence in training and innovation, in that we hope people who will come here to train can then take the information outside in both providing care and providing research in children with disabilities. We do hope that this center will not just be limited to care in MTRH. Our greatest hope is that we will have community outreach, where we will cooperate with various health centers in the community and even individuals, community health workers, so that we can both identify children with disabilities early and offer adequate intervention. I see a future where we may be able to improve the potential of children with both mental and neurological disabilities. I see a future where this program may be able to increase the number of children with disabilities who improve their potential to play, develop, learn, and participate in the general growth of this country. And probably globally, our neighboring countries may also be able to learn one or two things from us and find ways of improving the potential of children with developmental problems.